Dear colleague, today I'm presenting a case of mesomelic dysplasia, which was discovered during a second trimester screening exam. Following this diagnosis, after appropriate counseling and genetic consultation, the couple requested a therapeutic termination of pregnancy in accordance with the procedures and timelines established by Law 194 of 1978. From the sequencing of the soma, which was performed on a skin sample from the fetus after the abortion that occurred at the 21st week, mutations were found in the ABC gene, a gene located on the short arm of chromosome 4, whose mutation is responsible for Ellis-Van Creveld syndrome. This syndrome, marking, is a mesomelic dysplasia, a congenital condition, that has an incidence of 1 in 25,000 births. It is transmitted predominantly in an autosomal recessive manner. Its main characteristics are ectodermal anomalies, among which we typically find hypoplastic or absent nails, altered dentition that may be either early or delayed, thin and fragile hair, trichomalacia, which severely affects the prognosis, and above all, bone dysplasias. These dysplasias are responsible for the main sign, which is moderate micromelic dwarfism, with greater involvement of the mesomelic and acromelic segments. Anomalies of the cardiovascular system are also frequent. In fact, cardiovascular anomalies are present in 50% of cases. In particular, we are referring to defects of the atrial septum, the ventricular septum, or the atrioventricular canal. Genitourinary tract anomalies are also commonly observed. Cognitive function, on the other hand, is normal. Let's now look at the features present in the examination in question. First of all, we can observe that the overall fetal biometry was 5 days smaller than expected for the gestational age based on the last menstrual period. In particular, all skeletal segments are below the 10th percentile, with the mesomelic segments of the lower limbs below the 1st percentile. It is possible to observe that both the tibia and fibula are curved on both sides, with redundant soft tissue in the lower limbs, or brachydactyly and clinodactyly of the 5th finger. The chest appears small in size with horizontal ribs, got relative cardiomegaly, and a hypoplastic left heart. The remaining fetal anatomy, as could be examined at this stage, was found to be normal. The placenta was normally positioned, the amniotic fluid was normal, and the Doppler flow measurements were within normal limits. The features observed suggestive of Ellis-Van Creveld syndrome have as a differential diagnosis another mesomelic dysplasia, namely Campaya-Martinelli syndrome, which is caused by a mutation on chromosome 9 and is inherited in an autosomal recessive manner. In the latter, however, there are no heart defects, no polydactyly, and most importantly, tracheomalacia is absent, while dolichocephaly, joint stiffness, and vertebral synostosis, causing scoliosis, are more commonly observed. Furthermore, it should be differentiated from Guan syndrome, which also known as asphyxiating thoracic dystrophy. A short rib dysplasia, characterized by a narrow chest, short limbs, and other skeletal anomalies, particularly a trident-shaped appearance of the acetabulum. This syndrome is inherited in an autosomal recessive manner and is associated with mutations in genes located on the long arms of chromosome 3 and chromosome 11, as well as on the short arms of chromosome 4 and chromosome 2. All of these genes encode proteins involved in intraflagellar transport, which is why this syndrome is classified among the ciliopathies. It should also be considered in the differential diagnosis with McKusick syndrome, a very rare developmental disorder characterized by genitourinary malformations, polydactyly, and very rarely, congenital heart defects or gastrointestinal malformations. Finally, there is chondrodysplasia punctata, a syndrome that is X-linked dominant. In addition to limb shortening of the humerus and femur, this condition also presents with cataracts, facial dysmorphisms, and valgus foot. In any case, the diagnosis cannot be based solely on ultrasound findings, and therefore it is necessary to recommend genetic counseling to the couple, molecular karyotype analysis using array CGH, with particular attention to the study of skeletal dysplasias. In the event of pregnancy termination, a photographic radiological examination should be requested, along with the preservation of a skin sample for somatic studies. Below we are attaching photographic evidence from a similar case in which it is clearly possible to observe part A, polydactyly, brachydactyly, and clinodactyly of the fifth finger, micromelik dwarfism with redundant soft tissues vivid and a narrow chest, and a narrow. All of these are characteristic signs of Ellis van Creveld syndrome. Thank you for your attention.